Hi everyone, my name is Brittany Looney. I am an MSN student here at Liberty University, enrolled in Nursing 624 with Dr. Tracy Hudgens. This is a PowerPoint presentation on the role of the nurse leader in healthcare, specifically as it relates to the inadequate meal breaks that are provided to healthcare professionals. You may hear my daughter, Claire, in the background cooing or screaming, one of the two, or you may hear my dogs. So I do apologize for some background noise, but thank you for taking the time to watch and listen to my presentation, and I hope that it can educate you and change your perspective of meal breaks in healthcare and what standard we as nurse leaders and nurse professionals need to be accepting of and truly abide by while we work here in healthcare.
Inadequate meal breaks are common complaints among many healthcare professionals in today's society. Unfortunately, having inadequate meal breaks leads to life-threatening safety issues both for patients and for providers. Not only can it place the patient's quality of care at risk and provide a lower quality of care from the providers, but it places the providers at risk because it essentially puts them in a more vulnerable situation. Meal break policies may vary from organization to organization and could even depend from department to department, but they have been identified as one of the main areas that, if approved upon, would create a healthier work environment for nurses, for ancillary staff, just for everyone in general in the healthcare world. The Fair Labor Standards Act is overseen by the Department of Labor here in the United States, and what this act does is it actually creates guidelines for organizations to use in terms of paying an employee minimum wage, what kind of hourly requirements require overtime pay, what kind of records must need to be kept, and how the laws really affect people under the age of 18. Now, I thought that I was well versed on the Fair Labor Standards Act simply because it seems pretty self-explanatory. But after doing some research into the inadequate meal breaks that healthcare professionals are experiencing in today's society, I really learned that I didn't know anything about the Fair Labor Standards Act. And what I thought I knew, I was wrong about. Nowhere in the Fair Labor Standards Act does it say that individuals have to have a meal break. It's not required by Virginia law or by federal law for individuals to have a meal break, which was baffling to me. I did not know that. I simply thought that a meal break was obligated by some type of standard, but it isn't, not by this Fair Labor Act. What is actually the case is that if you don't take a lunch break, their company is required to pay you for it. There has to be a difference between paid and an unpaid break, and that's truly the difference in what this act stands for. Employers must pay for the hours worked, even if the employer has designated that time as a break time. This issue is made personal for me as a staff nurse at my local emergency room. Approximately 2 years ago, we made a change that impacted the nurse's role in the department. We went from having one nurse to a 4-patient assignment to changing it to a group of patients for 2 nurses. And so basically what that did is that increased the patient-to-nurse ratio. So now instead of 1 nurse and 4 patients, you have approximately 2 nurses to about 10 patients. So that gives 1 nurse an additional patient. But in addition to this, the department decided to utilize sub-waiting rooms. So each section of the department that is staffed by 2 nurses has its own individual waiting room. And that helps to decrease the use of the lobby, but increase the use of the sub-waiting room. One of the primary goals behind using less of the lobby and more of the sub-waiting room is that being in the sub-waiting room, the patients are able to be rapidly assessed by the providers, whether it's a physician assistant, a nurse practitioner, or an MD. They're able to essentially have their first assessment completed so that the providers are able to order diagnostic studies, x-rays, labs, medications, things like that, and the nurses are able to start these things while they're actually still waiting in the sub-waiting room. And on paper, that sounds wonderful, but when you have 2 nurses with 10 rooms and then a sub-waiting room, that gives those 2 nurses close to, on an average day, 15 patients. And that's not a safe ratio. It's just not a safe ratio, and that has to be addressed, because not only do the nurses get burnt out, but the patients don't get the attention that they need. With this change in the nursing process came an increase in nurses not getting adequate meal breaks. Now the nurses don't feel comfortable leaving their partner in this patient assignment with 10 or more patients for one nurse for a 30-minute time frame. Even if they are low acuity patients, it's still a high census, and it's still not a safe nurse to patient ratio. And so with that came a new policing, if you will, of the lunch break, where the administrative assistant would keep track of who missed what break and why you didn't take a lunch break and whether or not the charge nurse approved it and things of that nature. And from there passed it on to the director. And then if the director got word that, you weren't taking a break or that you didn't take a full 30-minute break, then you called into the office to have a discussion. And unfortunately, the morale and the impression that was perceived by the staff nurses by experiences with the nurse director was that if you did not take a lunch break or you did not take a full 30-minute break, then you were expected to clock in and clock out regardless. That 30 minutes was coming out of your paycheck regardless of whether or not you took your meal break. And if you did not physically clock in or out for it, you had to sign a Kronos edit form that said you did, even if you didn't. And that pressure was a little frightening because you didn't feel safe to speak up. You didn't feel safe to say, hey, I didn't get to eat, or even use the bathroom during this 12-hour time frame. And that's something that went unaddressed for quite some time in the emergency department until employee satisfaction surveys came around. After those were opened up, the issue was thoroughly pronounced. By having staff nurses that don't routinely take a lunch break, and if you're doing things correctly, meaning not what the emergency department is doing, meaning that you would not pay them, or you would pay them depending on the route that you're taking, it could cause a lot of casual overtime, which is something that some departments really focus on, whether or not the FTEs are met and whether the casual overtime is excessive, because it may affect the ability to hire for additional positions. And as I mentioned previously, with this federal law, this Fair Labor Act, employers have to pay employees for the hours worked, even if the employer says that the employee had the ability to take a break. And that's not something that was occurring in the emergency department, and it's still not occurring. However, throughout this presentation, I will suggest a resolution. After the issue was identified through employee satisfaction surveys, the nursing administration of the emergency department tried several methods to try to resolve this issue. The first was that they would take the 2 nurses and assign them lunch breaks. But this was unrealistic because saying, oh, I'm going to take my lunch break at 11:30 didn't necessarily fit into the unplanned emergencies that happen in an emergency room. You may get a cardiac arrest at 11:25, and then there's no way that you'd be able to take a lunch break at 11:30. The second attempt that they made was to have the charge nurse oversee the section while one of the nurses went to a lunch break, but that too was unrealistic because it was bogging down the charge nurse. The charge nurse could no longer assign patients to the correct section, designate where EMS crews were going to go because they were too busy taking care of these patients in their patient assignments. The method that I propose to resolve this issue seems relatively simple, and that is to add an additional staff nurse. The methods that have tried to utilize already established roles, they simply don't work. The means aren't there. the staffing numbers aren't there. But if they were to have an additional staff nurse, then this may be something that could be flexible, such as if it's a low census day, they could relieve all of the nurses for lunch and then they could end their shift. Or if it is a very low census day, they may even be able to be called off before the shift even begins. And that's something to take into consideration, whether it be a PRN staff nurse or a full-time staff nurse that also performs other roles as well. In order for this proposed resolution to actually be beneficial to the department, it truly must be adopted by the nurse leader and viewed as a positive thing. The morale within the department has been at an all-time low, and unfortunately, that's only something that can be changed by the nurse leader. But the effect that an additional nurse could have on the department would be huge, because the nurses often feel like they know the solution, they know the answer, and it's an additional staff nurse. So if that nurse were to be added, I feel like the nurses that have been vocal about their needs and their desires for this problem would feel more appreciated, and they would feel like their concerns and their ideas for a resolution are truly being heard and utilized by the nurse leader. It's crucial that the nurse leader in this situation remain active in identifying the issue, looking at what truly causes it, and looking at ideas for remedying the situation. It's also important that the nurse leader remain open and honest in her communications to the staff, and it's also important that she remain aware of the culture that's being created. She needs to stay a servant leader and stay respected within her peers, and that's something that's difficult to do when she may be struggling with realizing the issue or struggling with a solution that's appealing to the staff as well as administration that may be above her. And so that's a difficult thing for the nurse leader to fully accomplish and to accomplish well. Philippians 2 verse 3 reads, "Do nothing out of selfish ambition or vain conceit, but in humility consider others better than yourselves." And this is truly a good verse out of Scripture that helps to emphasize that we as Christian women and as nurse leaders should stay true to the Christian worldview. We need to remain acting as a servant leader both in our professional roles and in our personal roles, but it's something that we really must stay true to and be mindful of and remind ourselves of on a routine basis. I want to thank you for taking the time to listen to my presentation. I know it may have been a little distracting to have my baby cooing and cawing and sometimes crying in the background, but I want to thank you for just taking the time to listen to me and to hear out my point of view on the role of the nurse leader in the healthcare. I think that inadequate meal breaks are an issue that truly need to be addressed by nurse leaders and by healthcare organizations as a whole, because I think that it truly does take a toll on the role of the nurse, on the staff nurse, and I think that it has an effect on the nursing shortage that we're experiencing within the country in today's world of healthcare. So thank you. I hope that you have a blessed day, and feel free to reach out if you have any questions. I can try to answer them. Thank you.